Ever found yourself gasping for breath after just a short walk? You're not alone. This is an experience that many people can relate to, and it's not always a cause for panic. There are times when we all feel a little out of breath, whether we've been running for the bus, climbing a flight of stairs, or carrying heavy grocery bags. Shortness of breath, also known as dyspnea, is a sensation of not being able to catch your breath, feeling like you're not getting enough air. It's a common issue and can affect anyone, regardless of age or fitness level. It's not exclusive to the elderly or to those with chronic illnesses. Even the fittest athletes can experience it under certain conditions. In fact, according to the American Thoracic Society, nearly 1 in 4 people experience shortness of breath. That's a quarter of the population. So if you've ever experienced it, you're in good company. But while it's common, it's not something to ignore. Shortness of breath can be an indication of underlying health issues, ranging from mild conditions like anxiety or overexertion, to more serious health problems like heart disease or lung disorders. It can also be a symptom of high altitude or heat exposure. However, it's important to remember that feeling out of breath doesn't automatically mean you have a serious illness. It could be as simple as needing to improve your fitness level or adjust your breathing technique, and in many cases it can be managed or even eliminated with the right approach. But how do you know when it's more than just a temporary discomfort? When is it a sign of something more serious? These are questions that we often grapple with. To answer these questions, we first need to understand what could be causing this shortness of breath. There are a number of potential causes, and it's important to identify the right one to ensure you get the appropriate treatment. So, what's causing you to lose your breath? Let's delve in. Shortness of breath, or dyspnea, can be caused by a myriad of factors. Let's dive in and explore some of the most common causes. Firstly, asthma. This chronic condition inflames and narrows the airways, making it hard to breathe. It's like trying to breathe through a straw. You might experience wheezing, coughing, and a feeling of tightness in your chest. Asthma can be triggered by various factors like allergens, physical activity, or even changes in weather. Next on the list, heart conditions. If your heart can't pump blood effectively, it can cause breathlessness. Conditions such as heart failure, heart disease, or even heart attack can lead to shortness of breath. Your heart and lungs are closely linked, so when your heart isn't working properly, your lungs often pay the price. Then we have obesity. Extra weight can put a strain on your body, making it harder to move around and causing you to feel out of breath. Belly fat, in particular, can push up against your diaphragm, limiting the space your lungs have to expand when you take a breath. Last but not least, anxiety. Yes, your mental state can affect your physical state. When you're in a state of anxiety, your body goes into fight or flight mode. This can cause rapid, shallow breathing or hyperventilation, which can make you feel like you're not getting enough air. It's also important to note that these factors can interact with each other. For example, anxiety can trigger an asthma attack, and obesity can contribute to heart disease. But how do you know which of these causes is behind your shortness of breath? That's where medical professionals come in. They can help determine the cause and guide you towards the best treatment options. So if you're experiencing persistent shortness of breath, it's crucial to seek medical help. Remember, it's always better to be safe than sorry. Diagnosing the cause of shortness of breath involves a thorough evaluation of your health history and symptoms. Now, let's delve into the process of diagnosing shortness of breath. It begins with a comprehensive physical exam. Your doctor will listen to your lungs and heart, check your pulse, and inspect your throat and nasal passages. These checks can reveal signs of conditions that might be causing your breathing difficulties, such as congestive heart failure, asthma, or chronic obstructive pulmonary disease, also known as COPD. But a physical examination is just the first step. More tests may be needed to pinpoint the exact cause. For instance, lung function tests can measure how much air you can inhale and exhale and how quickly. Blood tests can help identify infections, blood disorders, or other conditions that could be affecting your breathing. Imaging tests, such as chest X-rays or CT scans, can provide a detailed view of your lungs and other structures in your chest. It's also important to give your doctor a complete health history. This should include any past illnesses, surgeries, or allergies, as well as any medications or supplements you're taking. Remember, no detail is too small when it comes to your health. Your lifestyle habits can also play a role in your breathing issues. Do you smoke? Are you exposed to secondhand smoke or other air pollutants? Do you exercise regularly? These factors can all affect your respiratory health, so be sure to be honest with your doctor about your habits. Also, don't forget to describe your symptoms in as much detail as possible. When did they start? What makes them better or worse? Are they constant, or do they come and go? The more information your doctor has, the better they can diagnose your condition. Remember, diagnosing shortness of breath can be a complex process. There can be many potential causes, and it may take time to determine the right one. But with a thorough evaluation and accurate information, your doctor can get to the root of the problem. Once your doctor has identified the cause, it's time to start talking about treatment. Treatment for shortness of breath depends on the underlying cause. Starting from here, let's delve into the various options available to manage this condition. Firstly, lifestyle changes can significantly impact your ability to breathe. If you're a smoker, quitting is the best thing you can do for your lungs. Regular exercise can also help by strengthening your respiratory muscles and improving your overall lung function. Dietary changes like reducing salt intake can also aid in managing conditions like heart failure, which may be causing your shortness of breath. But sometimes, lifestyle changes alone may not be enough. That's where medication comes into play. For conditions like asthma or chronic obstructive pulmonary disease, bronchodilators can help to relax and open up your airways, making breathing easier. In cases of heart disease, diuretics can be used to reduce fluid buildup, relieving pressure on the lungs. Now, therapy can also be an effective treatment. Pulmonary rehabilitation, for instance, combines exercise, education, and support to help people breathe more easily. It can be particularly beneficial for those with chronic lung conditions. Oxygen therapy, on the other hand, provides extra oxygen to those whose lungs can't get enough on their own. This can be a game changer for people with severe respiratory issues. Last but not least, in some cases, surgery may be the best option. Procedures like lung transplants or valve surgeries can be life-saving for individuals with advanced lung disease or severe heart conditions. However, it's essential to remember that treatment isn't a one-size-fits-all approach. What works best for one person might not be the best solution for another. Factors like your age, overall health, the severity of your condition, and your personal preferences all play a part in determining the most effective treatment plan. So, while it can be overwhelming to navigate the multitude of treatment options, remember that your healthcare provider is there to guide you through this process. Open communication with your healthcare team can help ensure that you find a treatment plan that's tailored to your needs. Remember, the best treatment for you depends on your individual circumstances. Living with shortness of breath can be challenging, but there are ways to manage your symptoms and improve your quality of life. Imagine you're walking up a flight of stairs. You're feeling fine, then suddenly, you're gasping for air. This is a reality for many people living with shortness of breath, but it doesn't have to be a constant struggle. Let's dive into some practical tips to manage this condition and enhance your everyday living. Firstly, regular exercise is key. Now, this might seem counterintuitive. After all, if you're struggling to breathe, why would you want to exert yourself? Well, regular, moderate exercise can actually strengthen your respiratory muscles over time, enabling your body to use oxygen more efficiently. Start small with gentle exercises like walking or swimming, and gradually build up your stamina. Secondly, maintaining a healthy weight is crucial. Excess weight can put strain on your lungs, making it harder to breathe. If you're overweight, consider working with a dietitian or healthcare professional to develop a healthy, balanced eating plan. Remember, it's not just about losing weight, but also about nourishing your body with the right nutrients. Avoiding triggers is another important step. Common triggers might include allergens like pollen or dust, cold air, or even stress. Try to identify what exacerbates your symptoms and do your best to avoid these triggers. This might mean using an air purifier at home, wearing a scarf over your mouth and nose in cold weather, or practicing mindfulness techniques to manage stress. Lastly, don't forget to take your prescribed medications. These can help control your symptoms and prevent flare-ups. Always follow your healthcare provider's instructions, and don't hesitate to ask questions if you're unsure about anything. Remember, living with shortness of breath is a journey, not a destination. It's about continual adjustment and adaptation. It's about finding what works for you and incorporating these strategies into your daily routine. With the right treatment and lifestyle changes, shortness of breath can be managed effectively. Prevention is always better than cure, and shortness of breath is no exception. Let's dive right into it. One of the most effective ways to prevent shortness of breath is to avoid smoking. The harmful chemicals in tobacco smoke can damage your lungs and heart, leading to conditions that cause shortness of breath. So, if you're a smoker, consider seeking help to quit, and if you're not, it's best to stay clear of secondhand smoke as much as possible. Air pollution, both indoor and outdoor, is another thing to watch out for. It's full of tiny particles that can enter your lungs and make breathing difficult. While we may not have direct control over the quality of outdoor air, we can certainly take measures within our homes. Things like keeping our living spaces clean and well ventilated, using air purifiers, and avoiding the use of chemicals or allergens that can pollute the air can significantly reduce your exposure to indoor air pollutants. Regular checkups are also crucial in preventing shortness of breath. They can help detect any potential issues early, giving you a head start on managing them. So, make sure to schedule routine visits with your healthcare provider. They can monitor your overall health and specifically your lung function and advise you on preventive measures based on your personal health profile. In addition to these, maintaining a healthy lifestyle can go a long way in preventing shortness of breath. Regular exercise can strengthen your heart and lungs, making them more efficient. A balanced diet can provide your body with the necessary nutrients to function optimally. And managing stress, through practices like yoga or meditation, can also help, as stress and anxiety can often exacerbate breathing difficulties. Now, prevention doesn't guarantee that you'll never experience shortness of breath. However, these strategies can significantly reduce your risk and improve your overall health. They're relatively simple to incorporate into your daily routine, and the benefits they offer extend far beyond just preventing shortness of breath. Remember, taking care of your overall health can help prevent shortness of breath. Shortness of breath can be a scary experience, but understanding the causes and treatment can help you manage it effectively. We've journeyed through the intricacies of this common yet often overlooked health concern, from understanding the multitude of potential causes, ranging from heart conditions to respiratory issues, anxiety to extreme physical exertion. We've explored the different facets of this complex symptom. We've learned that diagnosing shortness of breath involves a detailed medical history, physical examinations, and sometimes specialized tests. Our exploration of treatments revealed a wide array of options, from medications and lifestyle changes to more complex interventions. Living with shortness of breath is a challenge, but with the right care, it's manageable. We also touched on prevention strategies, highlighting the importance of regular exercise, a balanced diet, and avoiding triggers. Remember, if you're experiencing shortness of breath, seek medical help. Don't ignore your symptoms. Your health is your wealth,